The Council on Alcohol and Drugs, a 40-year-old nonprofit prevention and education agency, has developed the Georgia Prescription Drug Prevention Initiative. We proudly bring you this presentation on prescription drug abuse. It's not what the doctor ordered. This presentation was developed by Dr. Merrill Norton from the University of Georgia College of Pharmacy, Dr. Greg Raduca and John Brungel from the Council, and Aaron Lees from Early County's Early Choices program. It is narrated by Susan Blank, MD, President of the Georgia Society of Addiction Medicine. This presentation has been provided by the Georgia Department of Behavioral Health and Developmental Disabilities, the Division of Addictive Diseases, and the Office of Prevention Services via a contract with the Council on Alcohol and Drugs and the Georgia Prescription Drug Abuse Prevention Initiative. In addition, the Council works in collaboration with the Medical Association of Georgia Foundation's Think About It campaign, which also seeks to prevent prescription drug abuse in Georgia. The Center for Disease Control has declared a new epidemic, prescription drug abuse. Dr. Alex Kahana, Chief of Pain Medicine at the University of Washington, says, "As we speak, someone is dying right now." Many people are aware of the prescription drug abuse epidemic, but most have no idea how they might be helpful in preventing drug abuse. Our program has 4 objectives: secure storage and safe disposal of medications, prescription drug monitoring programs, public and professional education, and support of law enforcement efforts. These 4 areas have been identified by the U.S. Office of National Drug Control Policy as being critical for successful prevention. Controlled substances are drugs that have some potential for abuse or addiction. These drugs are regulated by the Federal Controlled Substances Act, or CSA. This law helps the U.S. government fight against the abuse of these drugs. The CSA divides controlled substance drugs into 5 categories called schedules. Schedules 2 through 5 are prescription medications, while Schedule 1 are illegal substances such as marijuana or heroin. While many people are able to safely take prescription medications without any problem, for some the results can be disastrous. Unfortunately, we don't always know of our personal risk until it is too late. Not everyone who uses drugs, alcohol, or medications will become addicted. Addiction is a brain disease which runs in families and includes the continued use of the drug or medication in spite of consequences. You can recognize addiction by the following: a powerful urge to obtain the drug by any means, increasing the dose to get the same effect. A person may become both physically and psychologically addicted to the drug. Dopamine is a powerful messenger or neurotransmitter in our brain, which creates a feeling of reward. It is what makes you feel high. Only a few chemicals on this earth have the ability to cause our brain to release this messenger. These chemicals, like alcohol, certain prescription drugs, or nicotine, are potentially addictive because our brain just loves dopamine. Most people have another messenger in their brain which shuts down the release of dopamine when our brain or body has had enough. People who have the disease of addiction don't have this second messenger, so they continue to receive the reward. They don't want to stop. After use of drugs for a period of time, changes occur within the brain, and now the individual will have very uncomfortable symptoms, both physically and emotionally, if they stop using the drug. They may even have potentially dangerous symptoms of withdrawal. If they stop using, they will have strong urges to use we call cravings. Since 2008, we've seen a significant increase in the number of people who misuse prescription drugs. In fact, the use has increased almost 50%. This has created what the CDC calls a prescription drug epidemic. Many people have the idea that the source of these medication drugs is a drug dealer or the internet. Nothing could be further from the truth. Actually, the most common source of these misused medications is the family medicine cabinet. Less than 5% come from a drug dealer, and almost 70% come from a family member or friend. This is where each one of us have an opportunity to help make a change. It used to be very rare for a young person's first drug of abuse to be prescription drugs. In fact, prior to 2009, the initial drug of abuse was usually marijuana. Now, more people start their drug-using behaviors by using prescription medications than start by using marijuana. You may be surprised to learn 2,500 teenagers begin using prescription drugs for the first time each day. That is more than 900,000 teens a year. More than half of teens believe it's easier to obtain prescription medication than drugs like marijuana or cocaine. Here in Georgia, within 1 year, there were 300,000 citizens who report using prescription medications for non-medical or recreational reasons. Sadly, on average, our children in Georgia start using prescription drugs and alcohol at age 13. In order to gain perspective about the number of doses of powerful prescription pain relievers being prescribed in Georgia, let's look at just 1 month, the month of May in 2014. Did you know that in that 1 month, May 2014, there were enough prescriptions written for every man, woman, and child in Georgia to each have 2 prescription pain pills? This is a staggering number. Please look at the top 10 most abused drugs in Georgia in 2014. Notice 5 out of the top 10 most abused drugs in Georgia were prescription medications. When we look at the medications or drugs most likely involved in overdose deaths here in Georgia, alprazolam or Xanax is by far the most common drug involved. These statistics do not even include some of the largest counties in Georgia, which are in metro Atlanta. Prescription drug abuse does not just affect those who take the drugs. Sadly, it also affects unborn children who can suffer significant and often painful symptoms of withdrawal after they are born if their mother was using or abusing drugs. In the U.S., there has been a significant increase in the prevalence of neonatal abstinence syndrome, from a little over 1 per 1,000 U.S. hospital births in the year 2000 to almost 3.5 per 1,000 U.S. hospital births in 2009. Georgia does not have a particularly high rate of children born addicted to drugs overall, but some counties in Georgia have up to 17 babies out of every 1,000 born who were addicted to drugs. Babies who are born to mothers addicted to drugs may suffer from a variety of unpleasant to potentially life-threatening symptoms. It is important that both the mother and the baby are provided with adequate care and support. Early prevention is the best way to avoid neonatal abstinence syndrome. Here in Georgia, we're fortunate to have the Prescription Drug Monitoring Program, or PDMP. This is a vital tool in preventing prescription drug misuse. It allows doctors and pharmacists to check and see that their patients are taking the medications that they have been prescribed, and that their patients are not getting the same or similar medications from other doctors or pharmacies. Not only can this help prevent abuse, it can also prevent dangerous drug-drug interactions. There are a number of ways in which each one of us can reduce the risk of prescription drug abuse. First, use only one pharmacy and have only one primary care doctor. Second, make sure you have informed all of your prescribers about all the medications you are taking. And third, if you or your loved ones are struggling with prescription drug misuse, please seek help. Addiction treatment works. You may not realize that it is illegal to take medications that are not prescribed for you. Do not sell or share your prescriptions with others. Take the medications exactly as directed and contact your doctor or pharmacist if you have questions, problems, or side effects. Safely store your medications out of the reach of children or pets. Secure potentially abusable medications under lock and key. Also, make sure that you safely dispose of any unused or expired medications. We will tell you in a moment how to do that. Once you have learned, educate your family and friends about safe storage of medications. Be sure to report to local law enforcement if you suspect someone is selling drugs or altering written prescriptions. If you have struggled with addiction to any substance in the past, please avoid situations where you're tempted to use or buy drugs. There are safe lock boxes for storage of medications. You can install this for use in your bathroom or kitchen cabinet. Please make sure you lock it. Since most young people obtain the medications that they use, quote, recreationally, unquote, from their own family or friend's medicine cabinet, make sure you properly destroy any unused or expired medications. There are a number of safe and convenient ways to dispose of these unwanted medications. Fortunately, every county in Georgia has a medication drop box at local law enforcement agencies. Please get paper and pencil ready for some useful website information. If no medication take-back program is available in your area, consumers can follow these simple steps to dispose of most medicines in the household trash. First, mix the medication in used kitty litter or used coffee grounds inside a Ziploc bag. Be sure not to crush tablets or open capsules. Then place the sealed Ziploc bag inside a plastic garbage bag and place in your trash. We want to encourage our physicians and pharmacists to use the PDMP for every patient. It is never too early or too late to educate our loved ones about the dangers of prescription drug abuse. We can all reduce prescription drug abuse by taking the simple steps for safe storage and disposal of these medications. We can each encourage our physician, dentist, and pharmacist to use the PDMP and remind them to educate all of their patients in safe storage and disposal. There are 3 social norms or unwritten rules by which our society functions, which can lead to prescription drug abuse. If it's legal, it must be safe. Wrong. Don't deal with your suffering or pain. Wrong. Pills are the answer to everything. Wrong. We want a pill to fix everything. Unfortunately, there are rarely any quick fixes. Most solutions take time and effort. Get your pen and paper ready. As promised, here is a website which is an important resource full of useful information and educational materials. By the way, RX stands for prescription. Please take a moment to write down www.stoprxabuseinga.org. That's stoprxabuseinga.org. The contact information listed on this slide can be used if you have further questions or if you would like to help others to stop prescription abuse in Georgia, because prescription drug abuse is not what the doctor ordered.